because they've got COVID positive patients, the pharmacy said that they wanted me to post the original prescriptions to them.
Their workload is up a quarter and their way of working has been turned upside down. Even the morning meeting between dozens of district nurses on shift in this part of Merseyside is now virtual.
Because it was really busy, that was the problem, because the palliative care team were chopping on that weekend as well. So.
Team leader Kim has been a district nurse for nearly 40 years and says things have changed fast.
It's a very different way of working. We had lots of meetings in rooms, but now we're very digital and very virtual. And it's really good. I don't think we'll ever go back.
But nothing can replace a home visit to a patient whose life depends on hands-on care. District nurse Beth is on her way to see a 77-year-old man with cancer who needs medication through his stomach 3 times a day. He's just been released from hospital where he tested positive for COVID-19. Beth isn't sure if he's still shedding the virus, so has to wear PPE.
I feel used to it. It's sort of just become like the new normal, really.
Back in his own home, Anthony is doing well, but the district nurses are also seeing patients with and without COVID symptoms passing away in the community.
We do go and see patients who have no symptoms whatsoever, and like Tony that I've just seen then, he said that he had no symptoms. The only symptom he had was a temperature, which he found out when he went into hospital.
Many have had critical hospital appointments cancelled because of coronavirus, adding to the pressure on district nurses.
Hiya, Kat, Joanne. Let me have a little look at your legs at the bottom. Is it sore?
60-year-old Karen has terminal esophageal cancer and has discovered a new lump.
Now this COVID-19's come along, I feel like I'm getting left and not getting no treatment. I know I'm not going to get better. I know I'm not curable. I've got to live with that. But I've got 4 children and I want to live full. So it's constantly on my mind. I don't want to close my eyes because I don't want to die.
In Croxteth, this health centre is empty, with people only being seen at home or over the phone. Hospital discharge to care in the community has traditionally been a slow process, but coronavirus has changed that too.
We've accepted more complex patients out of our hospitals to allow our hospitals to be ready for the coronavirus. So routinely, some patients that we have seen would have been in hospital for that longer. So that convalescence has been out of here within the community.
Even when lockdown ends, it's unlikely care in the community will ever return to exactly the way it was before the outbreak of coronavirus. Lisa Holland, Sky News, Merseyside.